Welcome to Somerset Showcase. During the pandemic, we all agree that the heroes out there are the people working in healthcare. And so today we decided to interview a couple of local people who are working in healthcare during the pandemic. Our town nurse, Emily Lachance, and our health agent, Timothy Turner. Welcome, and first of all, thank you for all the work you're doing during this difficult time.
Thanks for having us.
You're welcome, yeah. Thanks for having us. Good morning.
So, a while back, I remember Holly McNamara saying that Emily hasn't had a day off since March, since the pandemic started. And so I wanted you to tell me, what's a day like for you during this? What do you do all day related to the pandemic?
A lot of phone calls, so a lot of questions from the public, questions from local businesses. I've tested positive, what do I do now? I have an employee who's tested positive. How do I treat the business? Do I have to close down? Things like that. But then also talking directly with patients and making sure that they get the care that they need, that they get all of their questions answered, that their loved ones are, staying home and quarantining and getting tested if they need to be, and things like that is a majority of the day. And now it's vaccines, and we're getting vaccines rolled out, and so the planning that goes along with that is a cumbersome process, to say the least.
So that has given us a little hope with the vaccine
absolutely,
out there.
absolutely. A light at the end of the tunnel, for sure.
How about Tim? What are your days like with this?
Well, I can't tell you that I've had to work every single day, but I would say most of the time, a Saturday or Sunday doesn't go by where I'm not, getting to her or texting or hearing from somebody outside, maybe another health agent, just looking for a little advice. We bounce things off each other because everything it's so fluid. It's been changing. The changes are not so rampant now as they were earlier on, and I agree. I'm thinking to myself, okay, the vaccines are here. Could we be getting near the end? I mean, even though the end may be the fall, and I don't say end, the hump, okay? I can wait till the fall. We can keep doing what we're doing, and maybe things get better quicker. But couldn't have done it without the help of Emily, for sure.
Oh, and vice versa.
And Chief Barros and anybody else. There's no way we could name everybody.
No.
There's so much planning and so much volunteerism went into getting the whole vaccine clinic set up. I've been involved with people that have been volunteering almost my whole life, and I got to say, some of these people seemed like that they were pushing each other out of the way to be a volunteer. That's how anxious they were to help. And once they got there, it really worked like a well-oiled machine. We each have our own job now. It's been a week. 2 weeks.
2 weeks.
2 weeks. And, so far it's been an excellent job done by everybody. The fire department could not have come along better, I don't think.
It's been a collaborative effort for sure. Many departments.
And of course, right now you're vaccinating all the first responders from the whole area. You're doing
Correct.
7 towns. How do you feel about the vaccine? How are you confident that it's going to be very effective?
Oh yeah, the vaccine currently has 94 or 95% effective efficacy, and the only other vaccines really to have that same kind of efficacy are the MMR vaccine, the varicella vaccine, I believe, is up there as well. To see those kind of rates is not the norm. You think about the flu vaccine every year, and it's only sometimes on a good year, it's about 40 or 50%, and we get excited about that. So to see these kind of numbers with what's going on is very exciting.
What do you say to people who are concerned about side effects?
So side effects to me are the small price you pay as opposed to getting the disease itself. I think feeling yucky for a few days, nobody wants to do that, but I'd rather feel yucky for a few days and know that I'm going to, survive, as opposed to potentially dying from such a serious disease. And not to say that everybody gets that severe, but the chance is there, and it strikes. You never know when it's going to strike, right? So there are perfectly healthy people that get very, very sick, and then there are people who have some comorbidities who do fine. But that's the scary thing about this disease, is that it's so unknown.
Can you give us the time periods when certain segments of the population are going to get vaccinated?
Sure.
What is the schedule for that?
So right now we're doing the phase 1 group, and we're only about halfway through phase 1. So currently doing COVID-facing healthcare workers, so people who are working directly with COVID patients, ER nurses, ICU, that kind of staff. Then it moved from there and it went to nursing home staff and long-term care facilities and their patients, of course, as well. Then we did the first responders, and that's where we kind of jumped in with our clinics. And just yesterday, we opened it up to congregate care and shelter staff and residents. So in the next couple of weeks, we'll be adding in the rest of healthcare, so people who are doing healthcare but not necessarily directly with COVID patients. And then from there, we'll move into phase 2. And so that'll probably not be until the middle or end of February. And that'll start with the 75 and older crowd. People who have multiple comorbidities, so things like diabetes, asthma, high blood pressure, things that would make them more susceptible to having serious disease if they were to be infected. And then it'll move into the K-12 population as far as teachers and school staff. And then I believe after that it's the 65 to 75 crowd, then the one comorbidity crowd, and then the general public. So there's still some time to go before we hit the general public, and even some time to go before we hit, a lot of our seniors. But certainly we'll be posting updates on our website as each phase opens up and getting the information out there as best we can.
I can't wait to get my shot. But in the meantime, we still need to be cautious. We still need to wear our masks. In Somerset is still in the red zone. We have been since October. What do we need to do to get out of that?
Yeah, I think most of the state is in the red zone at this point. It's an unfortunate status that many of our towns have, especially in this area. I think as of last week, Somerset was about a 13% positivity rate, which is considerable considering just a month or two back we were only about 6%.
I think it was higher than Boston percentage-wise.
Right. So that just for every test that goes out there, every person that gets tested, 13% of them come back positive, and that's quite high. So I think really being vigilant on the mask wearing and staying away. I know we've all gotten tired of hearing social distancing, myself included, but it's really important. That's the only way we're going to, keep the spread down. And certainly, even once vaccines happen, it's not a magic cure-all. So it is going to be that a large portion of the population needs to be vaccinated before we really start to see results. And so I really don't think we'll start seeing a huge decline and relaxation of policies and things until the summer at the earliest. And even then, I think that's an early guess.
I've been noticing they've been announcing some concerts I want to go to, but I'm afraid to buy tickets because I'm like, are they really going to have these?
Right. I know. I heard a thing on the radio just yesterday for a concert, and they're like, "Oh, we'll give away tickets, but we don't know if anything will happen." So.
Okay. So I've also noticed it around town. Every once in a while, we see a restaurant close for a few weeks, or the lobby of my bank close for a few weeks, and I've noticed some other banks. So that's. So would they close down for a little while after a COVID case? What are they required to do in order to get back open?
They're not even really required to close. A cleanup is definitely in order. In most of the places that, as far as I know, I'll say all of the places that have actually closed, they've closed by choice. Some of them, they had maybe more than 1 or 2 cases. So to play it on the safe side, they closed for the 2 weeks, the 14 days. They went and got tested, but they just decided to ride it out. I know a few of them, and I'm not going to mention any names because I'm sure everybody knows who I'm talking about. But, you know, I've been doing my inspections a little bit differently this year just because of the way things have been going on. When everybody started to reopen back in July, we went and we hit everybody just so that way they knew what kind of, I wanted to do a face-to-face so they would understand the new rules that were out. You know, there was the attestation that they had to sign from the state, just for their own records, but it shows that they are following the guidelines that the state was recommending. Just about everybody already was. If you're in that business, you're going to keep an eye on things so you can make sure you can stay open. So, knock on wood, so far so good. The downside is, and this is the last week, I hope, and I think a lot of other of the business owners hope, is the downsize and the amount of people that they can have inside. You know, right now it's still down to 25%, and it makes it hard for a restaurant. Just to use that for an example, they have to have their staff in. They can't send 3 people home and be able to expect to run the kitchen. The kitchen is run the way it's run, whether you have 10 customers or if you have 30 customers. But as you can see, the payroll kind of, it doesn't balance out with the money coming in, and there's been a few places that have actually just decided to close and wait it out, only to have the governor extend it 2 more weeks. And since then, they've given in and they've reopened. But it's a struggle, and you know, I'll work with anybody that calls that needs advice, or maybe maybe I can do something to help them. I mean, you know, it wouldn't be anything financially or anything like that, but maybe just a nudge in the right direction, a little encouragement.
I think we've done a lot of brainstorming with businesses to try and figure out how they can get around some of these obstacles.
They're all different. You've got some of them that are brand spanking new, you've got some of them that are 50 years old, and then you have everybody else that's in between. They all have different capacities for diners or customers. You know, it's not just restaurants. You've got Eau Claire's Market, you've got Cumberland Farms, you've got Stop and Shop. They all have to follow that. And, you know, to the best of my knowledge, I live here, so I'm in all these places, and you know, even if I'm going to buy a gallon of milk, I'm probably going to be taking a look around the whole time I'm going to get the milk and come out. And they're doing the right thing as best as they can. That's all we can ask. They're doing the best that they can.
I think the important thing to remember too is sometimes when they're closing, it's not because they're, you know, having such a big outbreak, but maybe they have a number of their staff that are now quarantined because they had contact with somebody, and they just don't have enough staff to stay open. So sometimes, and then, you know, it's been the holidays too. A lot of places have closed down just because they were taking their usual break.
That is very true. Yep.
And so I think a lot of people are quick to jump to they must be closed because it's COVID, and it's not always the case. So.
I mean, they were worried about there being a big increase after the holidays. Have we seen that?
Oh, for sure. For sure. A huge increase.
You'll start to notice, like, especially with the states count. I mean, I keep an eye on that every day. And now that we're getting to almost 2 weeks, 3 weeks beyond New Year's, you're starting to see that the positive numbers starting to drop a little. I mean, they were up 6,000, 7,000 cases a day. In the last couple of days, it's been under 5 or right around 5. So is that a good sign? Maybe. Maybe that's the amount of people getting tested is starting to come down the other side too.
Yeah, I look at the Boston Globe's website every day because they have it up there, and I keep seeing it, and I want to see it go down. And I think the other day there was one where it was like in the 3,000s, and I said yes. But,
yeah,
we got to get down. We got to get down much lower than that. But,
absolutely.
But we've had people in town pass away from COVID.
We have. We've had, I think, about 50.
Okay.
50 deaths, yeah.
When somebody, so you do the tracing and you talk to the people who have COVID as well as other people they're in touch with. What is a person's mental state when they find out it's positive? How do they feel?
Yeah.
I mean, especially with this being something that's so new.
I mean, it really runs the gamut. Some people are, you know, kind of have the mentality of it's not if, it's when, and some people have the mentality, I think this is more the majority, are people that are very concerned. And so that first conversation is a lot of kind of just, you know, talking them down a little bit and kind of informing them of what to expect. I think people just have that fear of the unknown. So things to expect, things to look out for, and reasons to call your doctor as opposed to reasons to stay home, and resources, how are they going to get food, things that may not even be directly related to the disease, but now they're stuck home for a couple of weeks. So how am I going to get my food, my medications, things like that? And we have a lot of resources that we can direct them towards. So that's helpful.
And this can have a big impact on family situations,
Absolutely.
Having to isolate in different rooms.
Yeah, and it gets really tough too with children in daycare. So if, say mom or dad tests positive and now the child doesn't, but they're quarantined for sometimes up to a month, depending on the family situation. And so, mom or dad might be able to go back to work afterwards, but the kids are still home. And how do you manage that without potentially exposing others? And it can get tricky. It can get certainly very tricky.
Yeah, I mean, never mind the whole mental end of it, I mean, a year ago, I could have a conversation with you and say, you remember when we were kids, there were 10 kids in the neighborhood, we all went out same time, we all came back the same time, nobody thought anything of it, nobody stayed inside. That's the old story going back 100 years. Even we were inside too much, but I don't think we were. But now, it's so different. Even before this happened, so many kids are just inside. The computer is the babysitter or something to take its place. And now it's almost a forced thing because at least they had school to be able to go to. I mean, if you're A through M, those are the people you're seeing live. If your best friends, their last name starts with an S, they're at the other end of the week. And so to see them live, it would have to be something that they would have to arrange on their own versus just seeing people in school like society every day, And I think it's been difficult on parents as well as kids. There's a lot of fear about, she gets the phone calls, she handles the contact tracing because that's not, I'm not in on that. That's with HIPAA and everything, it doesn't allow me to get involved. That doesn't mean that people are not calling me, because they do, and then I refer them to her. But it's not just, wait a minute, you got the wrong number, take this number and call Emily, I can't be bothered with it. It's not like that. When they call, they need to talk to somebody for a minute. And they'll give you your story. Sometimes they give me more information than I'll need, but I mean, it's safe here. And it's like she said, sometimes people need to be encouraged. They need to be calmed down a little bit, and they just need to know that if they do what they need to do, things will probably be okay. First things I'll ask them is, have you gone to your doctor? If they're so convinced they have it, or if they get a positive test, automatically their name's going to go into a system, and eventually they're going to get a phone call or something telling them what they need to do. But in the meantime, I think I tested positive. I think I was exposed to somebody. Or my kid was over his friend's house and one of their kids got it and he came home. And it's just, you just have to be smart about it. If you keep an eye on yourself. If you think you're not feeling good, then you want to stay in one place, call your doctor. He may not even want to see you. He may just tell you, do this, this, and this, unless things get worse. I know people that have gone to the emergency room only to be sent home, and a day and a half later, they're back getting admitted, because that's how fast things went just in that day and a half, as far as their health. So we do listen, we do take every call. I try to call back any call that, if it's just a number looking for information, then I'll just pass it along to Emily.
Might take us a couple days to call back sometimes,
Well,
depending on the situation.
when she's handling 50, 60 calls a day, sometimes, it's not going to be a 30-second phone call when she's talking to somebody. It's going to be 10, 15, 20 minutes sometimes. It just depends on, who you're talking to and what their state of mind is, or their emotion, or whatnot.
Tends to snowball into another problem or another thing that needs to be handled too. So, one case can take 3 or 4 hours, depending on
Right.
what's associated with their lifestyle. So
Because sometimes, they'll call her or myself, and then all of a sudden they're starting to realize, well, wait a minute, oh, I did do this, or I did go somewhere, and I didn't think of that before, and that's when the phone calls can get a little bit stretched out.
Mm-hmm.
What are things that people absolutely should not do to avoid the virus?
stay home. I mean, they should do that. I should rephrase that. Stay home. I mean, it goes back to the basics of infection control. Wash your hands.
Yeah,
Don't touch
wash
your
your hands.
face. Wear your
Don't
mask.
leave the house without a mask. Don't go into a business
Yeah.
without a mask. Don't
Stay
even go
away
into
from-
somebody else's house without a mask, even if you know them.
Right.
You know, it's Russian roulette. You may be fine one day, but then all of a sudden, you know, the mother went to the store and she saw an old friend and she's talking to him and then finds out now she's not feeling good. She goes and tests positive, but in the meantime, people have been leaving the household with no mask or coming in to that household.
I think we need to go back to the beginning where we were, really being strict about it with ourselves. And, a lot of people tell me, well, I see this person all the time. Well, that's great. But, you may need to see them for childcare or for whatever reason. But that doesn't mean that you should go see them for, just casual dinner on Friday night without a reason to be there, because you never know what's going to happen 2 days from now. So anytime somebody tests positive, we look 2 days prior to their symptoms starting. So they might be infectious and not even know it, and that's the tough thing. So just to say, well, they feel fine today and they're negative today or whatever, that's great, but they might not feel fine tonight or tomorrow or the day after, and now you've been exposed. So.
I just rescheduled a trip I had to Arizona because my parents live out there, so I go out there to visit them, and I was scheduled to fly out in March, but I just changed it to August because I wanted to wait until we got vaccinated.
And it's tough because people are staying away from their families, and nobody wants to do that. Nobody wants to do that.
You have to find your own world that you're in, and you want to try to limit it to that. I do my best. I go to work, I go home. I've been to my parents' house, but I have two brothers, and I think they may have been once over there since this all started. I mean, I have a couple of stores that I go to regularly, but that's it. We haven't been out to eat in so long. We haven't been to anybody's house anywhere, even our in-laws. I have not been to their house once since all this started. And it's just to be safe because these are people that we're not with all the time. So it just doesn't make any sense to try to, like I said, Russian roulette. I don't want to take that chance. I've seen people that have had it, and I do not want it. Nobody wants it. It's not a cold.
Now, the regional school committee last night had a little bit of a debate about pool testing. They've applied to do it. They haven't been accepted yet, but there was a little bit of a debate with a parent about whether they should do it or not. How do you feel about the pool testing for the schools?
I've only read into it a little bit, so I'm not super well versed in it. I think it's an interesting attack on how to approach this. But I just don't have enough information to form an opinion one way or the other just yet. But I'm certainly curious to see the places that do it, if it works for them or not. I think it's each district might have a different approach to it, and for different reasons, depending on how your community is set up and what your availability of testing is and all kinds of things. So we'll have to see.
It almost chimes in a little bit to like the herd attitude, I mean, okay, you get a classroom of kids, one kid tests positive, they're all considered positive. That's fine, but at the end of the day, it is designed to save test kits, designed to save time, and designed to save money. That's what the whole thing is about. Will it work? Well, it might. I mean, they get that one kid, then yeah, everybody else in the room should be concerned. But the other kids may be negative. They may never have it, but they're kind of being, they're all being put in the same category.
The other concern was the staff, because if you have one teacher test positive, you could have 15 teachers out. They were talking about last night, and that.
Yeah, I'm not sure exactly how they'll group the each pool, so to speak. I'm sure they'll have to take things like that into account. But more to come.
More to
come.
Yeah, I had read
sure.
early on. So say you're positive, you don't know it yet. You go to the doctor, and you find out, but you've been doing your thing for the last 2 or 3 days. You could have ultimately infected up to 7 people just yourself. It's not your fault, just not knowing. But I think that number's probably come down because people are paying attention to what they need to do, and for the most part, I think people are respecting each other I have not been anywhere where I've seen somebody not wearing a mask lately. I'm talking for weeks. At first, you had people going into Eau Claire's and Stop and Shop or the country store or wherever they were going. They come in without the mask and they were told. I know country store in Eau Claire's for a fact, you cannot go into the store without a mask. If you have a medical problem or you just choose not to wear one, they have curbside or they'll bring it to you. That is their answer to it. Stop and Shop, from what I understand, they weren't allowing masks, but I can't say that they don't have anybody slip by with it. But I know I've spoken to the store manager, and if he sees somebody not wearing a mask, he asks them to put it on, and if they say no, then he asks them to wrap up their visit like in minutes. So they get it. People get it.
I notice going around town or wherever I go, most people seem to be wearing
think
them.
that
I've
people-
seen very few people.
I think we have a very
In this
compliant
area, I mean, we've done the clinics for a week now, almost 2 weeks. I think one person showed up so far out of hundreds without a mask, and it was just a matter like, oh God, I forgot it. We had them there.
We've all done it.
We've all done
it.
I did it this
I
morning.
keep them right on my center console,
Right.
but every once in a while I'm rushing it.
Yep.
Yep.
How many? And the other thing people ask about a lot is how many of the cases are in the nursing homes?
Again, fluid situation, so it changes drastically from week to week. So we can have a month where we have a third of a nursing home is infected and they're having a big outbreak, so to speak. And then we can have weeks go by where they might not have anyone. We've had some nursing homes that have had no cases for the first 6 months of the pandemic, and then they get hit hard. And then they go back to a more of a less status, for lack of a better word. But yeah, it really goes back and forth.
Well, you guys are doing such a good job down at the fire department.
Thanks. It's been a huge collaboration. It's been nice to see everyone come together. But we couldn't have done it without each piece of that puzzle, man. It's been a lot of help from a lot of people, and it's shown. But it's gone off so far without a hitch.
I'm happy to do it, and everybody
Yeah.
else is down there happy. I mean,
Yeah.
I gave up my whole day Saturday to be down there. I volunteered. It's not a work day. And a lot of other people did too. And we're talking all walks of life. A woman I was working with, she was an older woman, and she did a great job. And somebody else that age or that to that end might say, "Oh, that's not for me. Not for me. I don't want to take a chance." But these people are brave because they haven't all been vaccinated. So when
We take a lot of precautions.
we
though.
do. Oh yeah, we do.
We're outside. We're away from people.
Building's well ventilated.
Nobody's really getting within 6 feet of each other, except for the actual person vaccinating. And yeah.
Okay, this is my last question. So, what are you guys going to do after this is all over?
Take a nap.
Is there going to be a big party somewhere?
Oh man, a long vacation, I tell you. Sorry, Tim.
No. Listen, I haven't had any time off in a long time. I have time from last year, and I have all my time from this year. It would be, I would look at it, it would just not be the right thing to do, to go take 10 days off right now, to go wherever.
It's hard to take even a day off now.
Even between Friday and Sunday, I'm like, I'm sorry, it's me again. Listen, I just had somebody call.
Yeah.
You're like, it's all right, I was working anyway. To the point where you were home. What was that stretch? Something was up, and it was nonstop. Let me just say that while she was home. Every single minute of every single day, you just didn't know what was going to be next. And like I said, I get my calls at work. She's got the cell phone that's connected to the work phone, and me. That's it. And she doesn't have a lot of control over it. At least with me, if I don't get as many live calls on the weekend that she would be returning. But as soon as I come back, I know today, I've been out in the field this morning, but when I go back today, there's probably going to be 10 calls, and most of them are going to be, when can I get my vaccine?
Yeah.
I have a father who's 90, or I have immunity problems, or I've got a couple of comorbidities. I want to know, I need to know. And even while we were doing it, there were some people that had to be turned away, which I don't like to bring up, and it can be a little
It's difficult.
disheartening. That's a weak word to use, but they're not very happy, and it's because it just was not their turn yet. And
We have
you
such
let
limited
one,
doses.
it's not going to be fair to the ones that you've already told no to.
Yeah.
So everybody just needs to be patient, and everybody's going to get theirs.
Yeah. And it'll happen I mean, in the scheme of things, it's happening pretty quickly.
We're moving along. I think
You
we're
know,
moving along
to
at a
think
good
that
pace.
we might have everybody potentially, vaccinated by, say, June, in a 6-month period, considering we've already been through, at that point, 15 months of pandemic. In a less than a third of the pandemic, we can get everybody vaccinated. I think that's relatively. I think people need to just put it in perspective. It feels like a long time. We're all ready to be there, but we'll get there.
Yeah.
We'll get there, one day at a time.
I agree. I think it's not so much, can we do this any faster? Can we do this any faster? I think it's more important that we don't take a step back. Let's just keep going. The pace we're going, and there doesn't seem to be anything in its way right now.
Right.
Okay. All right, well, thank you for answering my questions. Thank you to Town Nurse Emily Lachance and Health Agent Tim Turner for joining us today, and thank you for what you do again. Our musical guest for today's show is Lindsey Arruda. Lindsey is a freshman at Providence College in the honors program, where she majors in both biology and music. We know her from Somerset Berkeley Regional High School, where she was the president of the Electrify Show Choir, and she was also the Music Town Queen. She's been the lead singer of the local classic rock band Out of the Blue. Her two passions in life are charity and music. Her and her brother Casey started the Boston Strong Foundation, in which they sold wristbands to help the people, the victims of the Boston Marathon bombings. They also started the We Stand Strong Foundation to provide immediate assistance to those suffering from tragedies and disaster, and they've helped people from around the world with that foundation. They have also organized a town-wide day of service for Somerset. Here is Lindsey Arruda.
Well, you done me and you bet I felt it. I tried to be chill, but you're so hot that I melted. Fell right through the cracks. Now I'm trying to get back. Before the cool done run out, I'll be giving it my bestest. Nothing's gonna stop me but divine intervention. Reckon it's again my turn to win some or learn some, but I won't hesitate no more, no more. It cannot wait. I'm yours. Hey, hey. Well, open up your mind, see like me. Open up plans and damn, you're free. Look into your heart and you'll find love, 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 love. Listen to the music of the moment, people dance and sing. We're just one big family, and it's our God-forsaken right to be loved, 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 loved. So I won't hesitate no more, no more. It cannot wait. I'm sure there's no need to complicate. Our time is short. This is our fate. I'm yours. Do you do 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 do? Don't you want to come on? Scooch on over closer, dear, and I will nibble your ear. Super dope, bo bo. Whoa, whoa, oh, 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 oh. I've I've been spending way too long checking my tongue in the mirror and bending over backwards just to try to see it clearer. My breath fogged up the glass, and so I drew a new face and I laughed. I guess what I've been saying is there ain't no better reason to rid yourself of vanities and just go with the seasons. It's what we aim to do. Our name is our virtue, but I won't hesitate no more, no more. It cannot wait. I'm yours. Open up your mind, see like me. Open up your plans and damn, you're free. Look into your heart and you'll find the sky is yours. So please don't, please don't, please don't. There's no need to complicate, 'cause our time is short. This is our fate. I'm yours. Bum to the bum bay. Do 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 do. Whoa. Whoa, I'm yours. Oh, oh, I'm yours. Whoa, oh, whoa. Baby, do believe I'm yours. You best believe I'm yours. Mm-hmm. Follow the Moskva down to Gorky Park, listening to the wind of change. An August summer night, soldiers passing by, listening to the wind of change. The world is closing in. Did you ever think that we could be so close, like brothers? The future's in the air, I can feel it everywhere, blowing with the wind of change. Take me to the magic of the moment on a glory night, where the children of tomorrow dream away in the wind of change. Walking down the street, distant memories are buried in the past forever. I follow the Moskva down to Gorky Park, listening to the wind of change. Take me to the magic of the moment on a glory night, where the children of tomorrow share their dreams with you and me. Take me to the magic of the moment on a glory night, children of tomorrow dream away in the wind of change. The wind of change blows straight into the face of time, like a storm wind that will ring the freedom bell for peace of mind. Let your balalakia sing, oh my guitar wants to say. Take me to the magic of the moment on a glory night, where the children of tomorrow share their dreams with you and me. Take me to the magic of the moment on a glory night, where the children of tomorrow dream away in the wind of change.
Awesome performance, Lindsey.
Thank you.
I love the Scorpion song. And I mean, but you have a little bit of a background with the classic rock, because I know you've been in that band Out of the Blue. I've seen you perform at Spirit of Somerset before. Do you like doing that type of music?
Oh yeah, I love it. Big fan of the 80s classic rock stuff.
Yeah, the 80s is my favorite music. That's when I grew up. But what do you like about that type of music?
I just like how I feel like nowadays some music isn't as like technical and stuff. Like the 80s, they had great guitar solos and also like great ballads in the same song. So all the instruments got to showcase their abilities and stuff. And it's just like really great.
So that band Out of the Blue, are you going to be playing with them in the future?
Yeah, we were going to do a gig on Black Friday, but it wasn't safe with Corona and everything. So once everything's safe with the pandemic again, we'll probably do more gigs.
So maybe like some virtual performances.
That'd be good. Yeah.
That's based out of a local music studio.
Yes, Ray Mullins in Swansea.
Okay. So you're going to Providence College now, and for people that don't know, you graduated from Somerset Berkeley last year, where you were the president of the show choir, you were the Music Town Festival queen. How are things going at Providence College? Because I know you're a biology and a music major there. That must be a pretty demanding schedule, I would think.
Yeah, and I'm all remote this year because of the pandemic and safety concerns, but they've been doing a great job, both departments, with getting kids active, with people who are in person or remote. So it's been really great all around. And the choir that I'm a part of, we did a virtual concert, so that was really fun too.
Yeah, there's a lot of those going on right now.
Yeah.
Why did you choose a double major with biology and music? That's an interesting combination.
Well, I wanted to follow both my passions because in the future, I'd love to do some type of medicine and help people. And I also think whereas like medicine helps you like with your physical body and stuff like that, music kind of like feeds your soul and helps you that way. So I'd love to further my music either with a band or get voice lessons or something. So be able to combine like both my loves in the future.
Okay. And you became very well known around the community over the years for the community service work you did. I mean, I'll never forget that fundraiser you did for the Boston Marathon victims. You have more plans to be doing more of that in the near future?
Yeah, definitely. We were planning on going to Greece this summer to help build a clinic and give the eyeglasses from our We See You campaign there. But because of the pandemic, we have to push it back a little bit. But we're definitely continuing that. And when more projects come up, we're going to be doing some more.
Okay. All right. Well, those were all my questions. Thank you very much for coming on. And hopefully we'll be seeing you performing live in the future. And good luck at PC.
Thank you. Thanks for having me.